Welcome to the second video in the series Antibiotic Resistance and Dairy Producers. In the second segment, we'll discuss why antibiotic resistance is an important issue for dairy producers. Ever since learning that antibiotic use in animals and humans encouraged the development of antibiotic resistance, we've been trying to balance the use of antibiotics in humans with its use in pets and livestock. And yet, antibiotic resistance remains a growing public health concern. The Centers for Disease Control estimate that every year there are more than 2 million illnesses due to bacteria resistant to antibiotics. These are infections resulting in over 23,000 deaths annually. These statistics, however, don't convey the personal tragedy which can result from a resistant infection, like that of 11-year-old Addie Rerisich, described in this PBS Frontline story.
The next morning, Tanya Rerisich, a nurse for 16 years, took Addie to a local hospital where they said she had symptoms of a virus. But over the next few days, the pain spread and the fever got worse.
I was afraid. At that point, I remember being very afraid. And so I packed a bag and we went to another hospital that had specialized in children's care. I remember thinking, she looks bad. This is bad. Something's really, really wrong. They put her on antibiotics. Her blood pressure was dropping. They, were making space in the ICU for her. The next morning, she needed oxygen via mask. They looked at part of her lungs and diagnosed her with pneumonia. I remember sitting there watching the sun come up and thinking, how did she get so sick? How did this happen so fast?
Addie survived, but not before receiving complete lung transplants. In the U.S., however, every year, some 23,000 people don't survive their resistant infections. Faced with this growing threat, the medical community has embarked on a massive effort to slow the spread of antibiotic-resistant bacteria. Aside from research, there has also been extensive outreach efforts directed at both doctors and their patients. There have also been programs mandated to limit resistance. In California, for instance, every hospital and nursing home is required to have antibiotic stewardship programs designed to limit antibiotic resistance. Just as antibiotic resistance can develop in a hospital or nursing home, it can also develop on farms. When it does, it may render treatments that we've been using for years ineffective. So preventing resistance on the farm can also preserve the effectiveness of our dairy medication programs. This concludes our second video. In the next segment in this series, we'll discuss what good antibiotic use on a dairy looks like and how some of these practices can reduce dairy medication costs.